RealTalk Women's Health Chat. My name is Nicole Michalik. I'm from 92.5 XTU, and I'm going to be your host for tonight's event. I am so excited to introduce two experts for tonight's session. Gynecologist, Dr. Theresa Adeliyi, and women's health nurse practitioner specializing in sexual medicine, Elizabeth Kusturiss. Did I do those names okay? Awesome. Okay. I think, are you guys still on mute? Oh yeah, you guys can unmute yourselves.
You did an excellent job. Thank you.
There you go. I am so excited about this panel. I'm going to read your bios, but like, we're all about badass women here. And like, I can't wait to get into this. All right. So here we go. So Dr. Adeliyi is a board certified obstetrician gynecologist and is the medical director of the Virtua Center for Women in Voorhees. She received her medical degree from the University of Toledo College of Medicine and did her OB/GYN residency at Thomas Jefferson University Hospital. I live right near there. And Dr. Adeliyi is a devoted mother to her. You have an 18-year-old son?
Yes, I do.
What?
Making all my money. Yes.
You look like you're 27. She enjoys exercising, yoga, meditation. Well, that's why she looks so good. She does all the right things and spending time with her family and sister friends. Oh, I have sister friends too. I love that.
I love them. They're the best.
Yeah, the best. She earned her, okay. And Elizabeth has been a women's health nurse practitioner for over 10 years with a focus on women's sexual pain and dysfunction. She earned her Master's of Science in Nursing from the University of Pennsylvania's Women Healthcare Nurse Practitioner Program and is a fellow of the International Society Study of Women's Sexual Health. And in her spare time, she enjoys yoga, going on hikes or walks around Philly, spending time with her family and her little firecracker 3-year-old daughter. And her daughter may be popping in. And, you know, we were practicing just a little behind the scenes. She's like, oh, my daughter wants to be with me. I was like, this is about women that were awesome. So you bring your daughter along. And even crazier is that I started going to physical therapy to work with my pelvis and my lower back and my hips. And weirdly enough, my physical therapist talked about Elizabeth and didn't even know that we kind of knew each other. And I'm like, what a small world. This is so exciting. So, all right, I could be a chatty Cathy, as you know, so let's get into the important stuff. So we're going to go through some of the common questions that many women may be too embarrassed or too nervous to ask their OB/GYN. And again, we're going to have time at the end. So if we don't answer anything, we can do it at the end. But the whole point of this panel and why Virtua is so awesome is that like, we want women to feel comfortable with themselves. We want them to be empowered. We want them to know that like, it's cool to enjoy sex, you know? And if you have any questions, you have these experts that have dedicated their lives, went through hours and hours of school and studying to make sure you feel better.
Yes.
So, Dr. Adeliyi, we're going to start with you first, and we're going to just talk about something as simple as relieving UTI symptoms and how to prevent them from happening. So that's kind of like where we're going to just start, and we'll kind of go from there. And then Elizabeth, we're going to go to you next. We're going to talk about vaginal itching. So we're really diving into this.
Let's get it.
Yeah.
So I start by really telling women that UTI in women is more common than men, mainly because of our anatomy, right? So our urethra, which is the opening of the bladder to the external world, is shorter than men's urethra. And so it creates a situation where we have a lower threshold for infection. So just understanding that and why, especially for sexually active women, you can be more prone to having UTIs, that's normal. And then in terms of like, what can you do to try to prevent UTI? I would say it starts off with just having good hygiene practices. First of all, you are supposed to wipe from front to back, okay? And I think a lot of women sometimes will wipe from back to front, and you're essentially just transferring bacteria from the anal area to the vaginal area, and therefore it can create a situation where bacteria can attach into the bladder and then travel up into it. And so I would say having good vaginal hygiene practices, I would say to start with. Drinking a lot of water. I'm not very good at drinking water. I try really hard to do so, but drinking copious amount of water is very important because what it does is it dilutes your urine, and therefore it can help you flush out some of the bacteria that's already sitting in the bladder trying to attach into your bladder wall, right? And then also I've heard cranberry juice, which is actually a real thing, but it's not the, made from concentrate cranberry juice. It has to be real cranberry juice that you want to use. But
Yeah,
also
it's the just cranberry that you get at Whole Foods, and you're like this.
that's it. It doesn't taste that very good, right?
You like feel it in your gals, you know what I mean? But like it works.
Sour, not so sweet. Don't add any extra sugar to it. That kind. You definitely want to avoid right after, before, or definitely right after sex, because again, when you have sex, you're depositing bacteria. Your partner is depositing bacteria in your urethra, which is the opening to the bladder, and therefore you want to flush that out after intercourse. The kinds of food that you eat can definitely increase your likelihood of having UTIs, and therefore things that I love, alcohol, spicy foods, coffee, those are things that can actually increase your likelihood of having UTIs. And so I would diminish or at least eliminate some of those trigger foods. If you happen to be a diabetic and you don't have good control of your diabetes, it can create a situation because bacteria likes sugar. And so that's how they flourish. And so if you don't have control of your sugar, of your diabetes, you can definitely have increased predisposition to infection. When you do have UTI symptoms, typically you really need antibiotics to treat it. But while you're waiting for your doctor's appointment, the things that you can do to try to decrease the symptoms of that, again, increasing your water intake. Some women use Azo, which over the counter, which is actually pretty effective. And then Pyridium, it's a pill that can use to kind of stop the bladder pain from progressing worse. But ultimately, you do need antibiotic treatment, and therefore I would recommend for you to see your doctor so you can get the antibiotic treatment that you need.
So let me ask you a quick question in regards to, what about wipes, and what about douching, and what about like bath products? Like when I was growing up, my mom never let me use any bath products. And Nicole, only you're not doing bubble bath. And yeah. She was very, very particular. Like she wouldn't let me use any of that stuff. And I just wasn't sure if that was a real thing. And you mentioned after sex, like, is there wipes you can use, or do you recommend just making sure you pee?
I agree with your mom. The vagina, my PSA to women really is, the vagina is a living, breathing, cleaning machine. Okay, so just leave it alone. Don't do any extra douching. It just changes the pH of your vagina, so it's going to make it more likely that you have UTI versus helpful. The wipes, it's fine. It doesn't really hurt, but again, normal hygiene. All you need is a regular, tissue to just wipe, and that's it. Yeah, I agree with your mom. Don't do anything extra. It doesn't really help. It just makes you feel better, but it doesn't help.
And somebody asked about cranberry supplements. Are they helpful?
They are. Elizabeth is nodding. I think you can jump in here. But yes, they are helpful. The cranberry capsule, I believe, also is helpful. But again, it's therapeutic, right? If you already have UTI, it's not really going to solve that problem and actually cure it, but it will give you the relief of symptoms in between getting your appointments with your GYN provider.
So there's actually a brand called Theracran. It's actually been studied, and it actually can prevent UTIs if you actually take it like with sex or something like that. And there's also a supplement, D-Manos, that has a couple studies showing that it actually can prevent UTIs as well. It basically just prevents bacteria from kind of adhering to the urethral wall. Right. Yeah. So it can be more be like preventative, not necessarily like after you have it. Exactly. You need antibiotics.
Yeah, that's the rationale behind using cranberry, because cranberry juice has this compound. I forget the name of it, but it definitely prevents adhesion of the bacteria into your actual bladder wall, which is where the infection starts. Yeah.
Yeah. So Elizabeth, you could kind of talk a little bit about this too, or you both, because I think it's important, since we're kind of on this topic, before we move to the pain part. Vagina itching and then vagina discharge. Those are obviously two separate things. So maybe we want to talk about the itching first. Is there reasons for it? Could a UTI cause it? Is there certain clothing that cause it? And then we could jump into vaginal discharge, because I think a lot of women are unsure about how normal that is.
Yeah, for sure. So vulvar itching is really, really common. And I would say, honestly, the most common reason is actually just the plethora of feminine hygiene products, like the entire aisle of feminine hygiene products that women should not be using on their vulvas, but do. Because for some reason in this society, we feel like our vulvas and vaginas are supposed to smell like a rose garden.
It's not.
On the summer bottle, flower field, and like that's what your vagina is supposed to be for some reason.
It's supposed to be pristine.
Yeah,
yeah,
exactly. So the amount of things women use on their vulvas, so anything from body wash, especially actually because it has additional ingredients that actually are irritating to the vulva. You know, soaps. Really, I actually recommend to my patients only using either warm water in your hand, coconut oil actually, or just the only soap that I think is okay is Dove Unscented for sensitive skin. But the key factor is that it's a bar, not body wash. So scented laundry detergents, fabric softeners, like beads, bubble bath, like, you know, wipes, actually, I try to discourage my patients from using unless they're the water wipes that literally are just water in a cloth.
Yeah.
Just like various like scented or flavored lubes. And even for that matter, various lubes that are just like over the counter at CVS. They actually have a really high pH, so it can really alter the vaginal flora and cause irritation as well. Going to the gym and not rinsing, like even if you're not gonna go straight home and take a shower immediately, like rinsing your vulva off. So I tell women to just take like a travel size shampoo bottle, sit over the toilet, squirt off when you're in the gym, and change your underwear and your pants. So because sweat's a huge vulvar irritant that can cause itching and irritation.
So somebody just commented, what is the vulva? And so can you just, for women who aren't really, no, I will say women, learn your
vagina. Yes.
Listen, like feel, you should be feeling it. Take a mirror and look at it. I know you feel like that sounds crazy, but like it is a part of us. Like we should be like all into ourselves.
You should know, you should be very familiar with your vulva. I'm sure Elizabeth is going to carry it on, but there is a difference between vulva and vagina. Go ahead, Elizabeth. Yeah.
And actually, like in my practice, I actually have a mirror, a hand mirror in every single exam room. And I literally show women, I point out what's normal, what I see that isn't looking normal, what the structures are, how to apply various creams that I recommend, et cetera, because I think it's really important because most women don't know their anatomy.
Right.
So the vagina is the internal structure. So basically, you know, from the opening in, that's the vagina. The vulva is everything external, everything that you can see. So it's the actual opening of the vagina. If you separate, like slang is small lips, honestly, but you know, the labia minora, if you separate that, the opening, that's the vestibule. And then it's everything external, including like where your pubic hair either grows or doesn't grow. But that's everything external is the vulva.
Yes, I agree. The external, the lips, basically, the two lips that you have, the opening. This is my favorite, like, picture of my patient. This is your vulva, the lips. The inside is your vagina. I'm being a little graphic, but definitely, the vagina is where the penis goes into. That's it.
There you go.
Or the baby comes out of. Yes.
All right. So how about vagina, vaginal discharge, color, consistency? Is there some symptoms that we should be looking out for? And can a pelvic exam tell if it's normal or not?
Yes. Can I just say one more thing about the itching? I'm sorry. I feel like I just want women to know this. So the last thing that can cause itching that's really common, but that's like very, very, very underdiagnosed is you can actually have vulvar dermatological conditions that exist. And one of the hallmark symptoms is itching. So there's two conditions that are most common. It's lichen simplex chronicus, which is essentially eczema on your vulva. And also
that's like a way to describe it.
Yeah. And it's thickening of tissue, and you really can't actually see any of the changes unless you look under a microscope on wheels and do a biopsy to actually definitively get the diagnosis. But you know, if you have chronic itching and you eliminate all the irritants and, you know, you're still having it, if your skin's splitting and having little paper cuts on it, or if the skin's looking different, like white or thick, et cetera, there's a good chance you might have a vulvar dermatological condition, and you should definitely see somebody to get it evaluated because it's easily treated and controlled. You just have to get it diagnosed.
Really quick, because you mentioned lube. Do you recommend coconut oil for lube? I've seen a lot of that on TikTok,
absolutely,
Instagram, but that's
good stuff ever. Yes.
Coconut is good for everything, and including the vagina.
Essentially,
I
yes.
usually tell
like-
patients, just get a nice jar, put it by your nightstand,
Yeah.
and that's like
And like
your.
even
Yeah.
think about
Yeah.
it, like lube, if you need to give a blowjob, like it might taste better than him. You know what I
It's
mean?
true.
Like,
It's
Oh my
true.
God, that's true
100%.
though. That's very true.
100%.
yeah.
Yeah.
And Trader Joe's actually has little packets of coconut oil, so it's kind of like the perfect thing. So you don't necessarily have to have that glass jar underneath your bed.
You're like, hold
So,
on,
yeah.
let me open the top. That's a
Yes,
good thing. Yeah,
that's
the Trader Joe's ones. I never thought of that. So
yeah,
true.
there's
Like, they're
packets.
perfect.
Travel with it. Yeah.
You can, like take your teeth. Let's
Just get
go.
a dollop. A dollop. That's it at night. Yeah.
So good. Okay, sorry. Back to the discharge.
Yeah, the discharge. So, like I mentioned before, the vagina is a breathing organ, right? A vessel, and it's supposed to have discharge. Okay. I think a lot of women just think that it's supposed to be dry. No, it's not supposed to be just dry. There's a lot of things that actually mediates the discharge that you have, and vaginal discharge can actually vary from depending on which aspect of your menstrual cycle you're in, right? So in the first half of your menstrual cycle, your discharge that is normal looks like creamy, not creamy, white, milky, pasty discharge, and that's before your ovulation. And then the second half of your menstrual cycle, the discharge typically looks like clear, stringy, mucus-like discharge, and that is also normal. So there's different variety of varying amount of discharge that you have depending on the menstrual cycle that you're in, and based on how much hormone you produce during that particular menstrual cycle, the discharge can be more or less. And that's why some patients will say, oh well, I never really have discharge, or I don't have this much discharge. It really depends on your hormone status, right? So the discharge is normal. The amount that you produce sometimes can be more or less, and that is completely normal. Now, what's not normal? Abnormal vaginal discharge looks like white, clumpy, cottage cheese-like discharge. That can indicate more of like a yeast infection. If you have a gray-white discharge, also accompanied by maybe fishy odor, that usually means that you may have BV, which is bacterial vaginosis. And then, of course, when you have more like a yellowish, greenish, maybe foul smelling, that may indicate an infection. And definitely, like you were asking Nicole, a pelvic exam is really what's going to differentiate for you. Is it a normal infection, like a yeast infection, versus a STI, really? And so, yes, I would definitely recommend, outside of the range of the normal discharge around your menstrual cycle, I think it warrants a pelvic exam in order to be able to decipher between the infection that's just a benign infection versus an STI. Yeah.
Really quick, somebody said they're allergic to coconut oil. Is there anything you recommend?
What I tell some patients is, the vitamin E gel caps, if you squeeze that from in there, maybe a few of them, the same thing you can put right in the opening of the vagina.
Yeah.
One of my favorite lubrication is Astroglide. It's better, I feel like, than KY, and it's in a purple bottle. I always tell patients it's in a purple bottle. That's it. And then my go-to now is Uberlube. I don't know if anyone knows about that, but apparently it's the best thing ever. And also you can use it for your hair, apparently. But yeah, there's options out there. There's options.
Top and bottom.
Yes.
Yeah.
And I really like avocado oil, almond
Yes.
oil,
Yeah.
olive oil, like
yeah.
any oils, honestly, are
Mhm.
fantastic. And there's two water-based lubes that don't have a high pH, because a lot of like the over-the-counter ones do.
Yes.
And slippery stuff and Good Clean Love. They are really pure ingredients. They don't have an elevated pH. They also don't cause irritation. And
Did you say Good Clean Love? I need to write that down.
yeah, Good Clean Love. It's awesome. And same with slippery stuff. I actually use slippery stuff for my exams in the
You
office.
should have got a code word Virtua for 10% off. We got to work on that. Let's talk about discharge and the or odor. I'm sorry. We talked about discharge. What about odor? We talked a little bit about odor with the discharge. Is there any certain odors? There's always kind of, we hear the fishy smell.
Yeah.
Is there anything other kind of smells that we should look out for?
Yes. So like Elizabeth was saying, you are supposed to have some, what I quote unquote scent, right? It is that's specific to you. Like I mentioned, the vagina is a breathing organ, right? It's supposed to have odor. It's supposed to have, discharge, what's normal to you. What's not normal is, if you have this foul smelling strong odor. Like some patients would say, oh, I can smell it from across the room. That kind of odor, that may mean most common is BV, which is bacterial vaginosis. Other kind of odor can come on from hormonal changes, right? So depending on your diet, some things you eat can definitely change your odor. It can smell more like, I would say, musty in a way, or sour in a way. So that's another way patients describe their odor. If you're working out, if you're an athlete and you work out a lot, like Elizabeth was mentioning, you might have more perspiration and more sweating down there. And so it will smell like, I don't know, old rag, I don't know, what something something like that. And so I would recommend using more frequent panty liners and changing it more frequently. Your sexual activity definitely can increase the likelihood of also having weird different odors, again, because you're introducing different bacteria in the vagina, right? And so that mix and kind of upsets your pH, and that can cause different type of odors. So for the most part, though, whatever odor you have is normal to you. So what's not normal is a fishy smell, the foul smelling odor, and just like sour. And then of course, when you have your period, after your period, you can tend to have a little bit of what women call like old blood smell. There's not a better way to explain that, but yes, there are different types of odors. They're all mediated by some activity, your diet, and if that's becoming an issue for you, I would definitely recommend looking at what your diet is and trying to change that accordingly.
Okay. Yeah. Elizabeth, so 40% of women have trouble with vaginal or pelvic discomfort and sexual function. So let's kind of dive into pain and cramping and discomfort. We actually had a question that just came in that said intercourse is very painful after menopause.
Yeah.
So I think we can just kind of move on to the pain and just cramping, discomfort, and how to kind of start that topic, and we can kind of go from there.
Yeah, for sure. So, I mean, when we're talking about like deeper pelvic pain, like cramping, like the deep pain, not just like the opening of the vagina, and not just pain with sex, or even like just like deep pain with thrusting during sex, that's kind of like more in the category of, endometriosis, adenomyosis, basically where the lining of the end of the uterus, the endometrium, that lining is only supposed to be in the lining of the uterus. It's not supposed to exist outside of the uterus.
Right.
But in conditions where endometriosis is concerned, there are these little implants of endometrial tissue on the outside of the uterus, on the fallopian tubes, on the ovaries. It can even actually occur on the bladder, the colon, the appendix, and it can exist anywhere, honestly, which is kind of crazy. And then adenomyosis is where that endometrial lining actually starts to migrate into the muscle of the uterus, where it's also not supposed to go.
Right.
So when that happens, it causes deep pelvic pain. It causes pain with periods. It causes some women just have like an aching, heavy sensation. It often causes deep pain with sex. Those are kind of like the most common causes, honestly, of like deeper pelvic pain. Certainly you can have like pelvic inflammatory disease and things like that, which are, I would say, at least in my world, they're less common. And then you can have uterine fibroids, but uterine fibroids don't really cause pain. It causes more just like pelvic pressure. So I wouldn't really put that in the category of pain, but it's something that can certainly exist that causes a change in your normal symptoms. As far as pain with sex goes, though, and other types of pain, so pelvic floor dysfunction, really high tone pelvic floor dysfunction is really, really strong cause of pain with sex, or just pelvic pain. Just sitting here right now, some woman would feel like burning or an aching or a heaviness. Someone would even have cramping. Someone would have hip pain because the muscles, basically what happens with pelvic floor dysfunction is the pelvic floor muscles are all the muscles on the inside of your vagina. So it's almost like I tell patients, it's like a bowl of muscle. And the muscles can be like any other muscle in your body. They can be too relaxed, in which case you can have incontinence and things like that, and prolapse, or the muscles can be too tight. And when they're too tight, they cause pain. So there are literally tiny little muscles that wrap around the opening of the vagina. And when those muscles are tight, it causes exquisite pain with penetration. It can cause like a searing sensation, a sharp burning pain. It can cause pain after sex. A lot of women are actually misdiagnosed with yeast infections and various infections after sex because they have this like burning or itching, but it's not an infection. It's the muscles just being so ticked off, for lack of a better word, that they cause pain.
Causes the muscles to be ticked off and tight?
So there's a whole plethora of reasons. I would say the one common trait among every single woman that I see is anxiety.
Yeah.
I see patients, I do not see relaxed patients who are just like chilled out, et cetera, in my practice. I see women who are type A perfectionists,
Yep.
overachievers,
Yes.
stressors, women who have anxiety, because those women are not in a relaxed muscle body. They're in a tense muscle body. And whether you're tensing your neck, your shoulders, your butt, or your pelvic floor muscles without even realizing it, it becomes this habitual thing. And oftentimes it starts when you're a really young girl. So
Yeah.
these either have histories of, sexual trauma for sure.
Yeah.
Developmental trauma, growing up in a household where you have parents fighting all the time, alcoholic parents, something where basically it causes you to be tense on a consistent basis. And so these women are clenching from an early stage in life. Certain athletes, so ballerinas, gymnasts, cheerleaders, soccer players, interestingly enough, those sports just kind of have a predisposition because of the body mechanics of making your muscles just be in that tight state. Sorry, there's that little girl in the background.
She was going to make her face.
As I mentioned, sexual trauma for sure. Women who have histories of sexual traumas absolutely have high tone pelvic floor dysfunction. And then women who are in chronic pain. So if you have severe endometriosis, for instance, severe back pain, scoliosis, et cetera, the pelvic floor muscles, they're part of your core actually, and they aid in musculoskeletal support. So if you have weakness or pain elsewhere in your body, your pelvic floor kind of comes in and compensates for that lack of support. And when it does, they get overtaxed and they spasm and then they get tight and causes pain usually.
Yeah, it's kind of like akin to like when we talk about fibromyalgia, right? Fibromyalgia in general is more like a body sensitivity, high sensitivity to pain or touch that's sense as pain. I think it's the same thing. Hello. I think it's the same thing as like in the pelvic floor muscles. And definitely one of the things that women complain about is they would tell us that their partner feel like they can't like insert, like they can't penetrate. It's almost as if like the vagina is closing up on them. And that's exactly. Right. Yeah.
But it's really, really common. And the really sad thing is a lot of women, like I literally had a conversation with a patient today about this. I mean, women think that some degree of discomfort with sex is just
normal.
And it's not. I mean,
it's not supposed to hurt.
Yeah.
No. And they say, oh, well, isn't it supposed to hurt just a little bit? Or
no.
Yeah, sure, it hurts with penetration, but that's it. But that's a big thing. Like there should never be a moment where you're like, and then it goes away.
Right.
I would also add, sometimes definitely everything you said, Elizabeth, but sometimes what I ask my patients is like, use it or lose it, right? If you're not having intercourse frequently, the vagina is like a collapsible space, right? So if you're not frequently having intercourse, your vaginal muscle contracts. And so the initial time when you start resuming intercourse can probably be painful. And then a lot of times when women sense pain with intercourse, they start to get more anxious about it. And so it just kind of, it's like a cycle, you remember like the last time I had sex, it was really painful. And then the next time you attempt it, you're climbing up, you're getting anxious, and it just becomes more of a revolving cycle that kind of you have to break that cycle.
Exactly. This makes so much sense too, because women for so long, especially I want to say women over the age of 30, maybe even 25, where you're anxious too when you have sex and like, am I good enough? How do I look? Should I have lost weight? And then you're in your head, and then that it makes total sense.
Yes.
And then women think that this is just normal, and it's like, no, it's really
it's not. It's not.
This is why we do these things. Somebody asked, how do you diagnose endometriosis?
It should really be diagnosed. Oh, sorry.
Go ahead.
It should really be diagnosed, honestly, with a specialist, with an excisional specialist, actually. So the only way to truly diagnose it, historically speaking, has been a laparoscopy.
Yep.
But endo specialists actually can see changes via ultrasound and MRI. You have to be a specialist to do that. There's actually a it's a funny name, honestly. It's called Nancy's Nook, and it's a website that you can actually find like deemed excisional specialist, because you should never actually, you should never have surgery where you have ablative destruction of the tissue. It should always be excised out, otherwise it grows back and it doesn't actually usually relieve the symptoms. But it should always be a specialist who does diagnose
It seems like so many people are talking about endometriosis now. And I don't know if it's just because it's social media, it's because it's, there's been pretty big celebrities that talk about it. Do you feel like it's becoming more common, or has it always been there, but people are just talking about it more now?
I think it's the latter. I think it's always been there, but
Okay.
also, women in general, we just assume a lot of things that's happening in our bodies is normal.
Yeah.
It is not. And so I think in the beginning, when when they tell you when you start having your menstrual cycle, you're supposed to have cramping. It's normal to have cramping, but endometriosis in the early stages starts off with severe cramping.
Yeah.
A day right when your period starts, and it goes away as soon as your period is done, right? And it becomes a cyclic nature. So the point about it is every single menstrual cycle you have this severe pain. For many women, it's very debilitating. They don't go to school, they stay home, they have to pop a bunch of ibuprofen and pain medication to kind of relieve their pain. So that's how it initially starts. But I think a lot of women just deal with it for so long, they think it's just part of their normal menstrual cycle pain. And so they never really talk about it. And now it's becoming more popular. And that's why it's one of the questions that women really ask me when they come in. And like Elizabeth said, is a surgical diagnosis, which means I go in your belly with a camera and I see all the implants inside your belly, which is what she was talking about. You can have implants, endometrial implants on your colon, on your bladder, on just any organs inside your abdomen. That's how you formally diagnose it. But if it smells like a duck, quacks like a duck, it probably is. And that's one. So it's a clinical diagnosis in a way until you have a formal surgical diagnosis with the laparoscopic procedure.
Yeah.
But it just sounds like it's debilitating.
Yeah.
Sure.
So, but again, we were told oh, you're going to have cramps. So women just think,
right.
And it's wild too, to think how people are like, oh, you're in a bad mood, you have your period. I'm sorry, I have blood gushing out of my vagina. I have to use a cotton swab to stop it. Sorry if I'm in a bad mood, Brian. You know what I mean? Women were just supposed to suck it up. And
yes.
Thank God, this is why the internet is also good in a lot of ways. Because women have found a community. They're like, wait, I've been dealing with this my whole life. I didn't realize this is actually not normal. So thank God that we have brilliant women and doctor, all this stuff now, because we're doing stuff like this because women have been suffering for so long. And
we've been suffering for too long.
Yes.
For sure.
Yes. Okay.
Infertility. Infertility can be, some women actually don't have severe pain with endometriosis and they just have infertility. And then finally, they'll see a surgeon, they'll see endo all over the place. And that's a huge cause of infertility.
Yeah.
I don't want to belabor this, but I also want to make a point about adenomyosis. So a lot of people do not understand that the difference between endometriosis. Endometriosis is essentially the lining of the uterus outside of the uterus. It's not supposed to be anywhere but inside the uterus. Adenomyosis is essentially the same thing inside the muscle of the uterus. And if it infiltrates the entire musculature of the uterus, a lot of women actually talk about a lot of miscarriages. They can get pregnant, but they have a lot of miscarriages. And it's really important to talk with a doctor when you're on your third or fourth miscarriage. They've done all this blood work and nothing is showing why you're having miscarriages. I think it's important for you to mention, well, can you look at my ultrasound, hopefully with a specialist who knows how to see adenomyosis on ultrasound, to really look into that, because it's important, because no one really knows why, but essentially just makes it harder for implantation to happen. So you have you're more likely to have miscarriages.
Yeah.
It's an abyss of information. Endometriosis is terrible. And a lot of women just deal with it in silence.
Yeah. Yeah. So let's talk about going to the bath. If you're feeling you have to go to the bathroom, or leaks when women sneeze, laugh, or cough. Is this pelvic floor dysfunction? Is there certain treatments?
Yeah.
They just asked about incontinence.
Incontinence, yeah.
Yeah. And so is it an age? Is it a baby thing? Just kind of, if we could talk a little bit about that too.
It's everything you said. So if someone has leaking when they cough, sneeze, laugh, it's one form of incontinence, which is called stress incontinence. And that typically happens, like you said, a progression of your pelvic floor, like Elizabeth was explaining, typically it's supposed to have a certain level of tone. It's not supposed to be high tone. It's not supposed to be relaxed. It's just a happy medium, right? And so more commonly, women have had babies before. If you've had multiple babies or you've had big babies, they create a, pressure on your pelvic floor. So typically when you have a normal pelvic floor tone, you have as part of the bowl that surrounds your pelvis, there's a muscle that's around your urethra at the base of your bladder. It's like a hook, right? So when you cough, sneeze, there's a tension that's created when you cough or sneeze. On a normal pelvic floor, you don't squirt. But when you have a relaxed pelvic floor, that anatomy has changed, right? And so when you cough, sneeze, you're putting pressure not just on your abdomen, but also in your pelvic floor muscles, and that's how you squirt. The other types of incontinence can be what we call urge incontinence, what most people know as a overactive bladder. So essentially, you have this sensation to quickly void, but you don't really have a full bladder. You go to the bathroom and you're dripping, just drops, right? Not enough to make you feel this urge to and you can't get there fast enough. And then the third one is what we call mixed incontinence, and for the unfortunate woman is a mixture of the stress incontinence and then also the urge incontinence. So there's a hodgepodge of that. So what can you do about it? I guess it depends. It depends on which aspect of that incontinence that you have, right? So if it's overactive bladder, typically it's more medication that will help it. But I usually tell patients as well, you need to do more of like what I call timed voiding, because you have to retrain your bladder so that you're not getting this sensation that you have to void just with the smallest amount of urine in your bladder, right? So voiding every 2 hours or so will kind of keep your bladder empty. For mixed incontinence, it just depends on what's causing it. So I would definitely recommend seeing a doctor for that. Stress incontinence, the first step is really Kegels. There's different school of thought as to how many Kegels you do, but I know a lot of women do not do it right. I ask patients to tell me what they do, and they're like, it's just all wrong. I'm like, stop, it's just all wrong. And then, or they will say, I've done so many Kegels and it's not working. I'm like, well, how many did you do? Maybe like 10 a day. No, you have to do way more than that, So I would say stress incontinence is the most common type of incontinence that women get. And like you said, it's age, is genetic predisposition to it. If you have every woman in your family that's had incontinence, even though they don't have multiple kids, you're more likely to have it. If you've had multiple kids, you're more likely to have it as well. Yeah.
Elizabeth, do you have anything else to add on that?
I would just say the treatment, that's essential is going to pelvic floor PT, because you're saying most women do Kegels wrong. And here's the contrary to that is that some women, in the hopes of preventing incontinence, will actually go like Kegel crazy, and they'll do way too many. And what actually ends up resulting is a high tone pelvic floor.
Yep.
Crazy thing is you can have a high tone pelvic floor, tight pelvic floor muscles that actually still causes incontinence, because when you have a tight muscle, it's also weak. So you can have high tone pelvic floor dysfunction and also have incontinence, and women think, oh, my muscles are too relaxed, I need to strengthen them. No, it's actually, they need to be elongated and relaxed first and then strengthened. So truly an evaluation by a pelvic floor physical therapist is really, really necessary, just to kind of prevent further complications.
Shout out to Amy at Boston Builders.
Yeah, exactly.
I'm doing stuff. Mine is more like my hip flexors. But she does this stuff with me where she's like, you've been standing wrong this whole time. Like, you think you're standing up straight, you actually haven't been. And then she's like, you gotta feel, and she's like, you have to feel your hip bone. And now you have to push it out. And she's like, now you work on that. I'll see you next time. And I'm like, wait, what? And it's all these little movements that I've been doing forever, right? And I'm like, because I was like, I can't squat, my hip flexors hurt. And she's like, it's actually, and then we do these things with she's like, okay, you got to move it down an inch. And I'm like, I can't feel it. And she's like, you got to use your mind. I'm like, this is crazy. But again, women, we never make these connections with things.
No.
And there's, there's the pelvic floor physical therapist and there's the pelvic floor therapist. And that I just learned that too, that there's outer and then inner. So both are important. And I know people listening probably think this is so overwhelming, but that's why we have these experts here, so they could ask the questions. And so you can actually ask your doctor. Let's talk really quick, because it's crazy. It's already, 7:42, but how about lumps and bumps? We talked a little bit about that when we talked about discharge and odor, but obviously, talk about what could be maybe an STD or what could just be normal, and kind of how to go about that.
Yeah. So a lot of women, when they come to me, they have a bump and they just swear is herpes, right? I would have to say majority of bumps that you notice down there is not herpes. It's typically benign. So the kind of bumps that are, I'll talk about herpes symptoms later, but you can have like just an actual pimple down there because your labia majora is like your regular skin. It has hair on it. So you have hair follicles. So you can have pimples, you can have ingrown hair. And then when you have chronic ingrown hairs, it can progress to like what we call folliculitis. So inflammation of that hair follicle, right? So that creates a bump. Now, a lot of women are concerned there might be something going on. You can have what we call skin tags. It's just little cauliflower looking, dangling skin tags. They can be one, they can be many. Those are also normal. Some of them can be warts, like HPV warts, but for the most part, it's actually really just benign. When you have a hair follicle that's inflamed, it's gotten bigger, it can be what we call a boil. The medical term is called furuncle. So those are the progression of different bumps that you can find down there. That's also completely normal. Now, herpes bump, it actually really looks like a pimple, but the way I differentiate it is a pimple has like a yellow or white head to it. Herpes one has just clear like fluid inside the small vesicle that we call a vesicle. And so it can have clusters, it can just have one or two. But the difference is before you get the bump from herpes, you typically have this like irritation, just like tingling. It just feels like your underwear is really bothering you that normally doesn't really bother you. And then a few days later, it becomes like this like pimple. And then 3 days later, it crusts over. And a lot of people mistake that for yeast infection because yeast infection symptoms starts off as, itching and irritation, but usually you don't have any bumps. So normal bumps are benign. I mean, most bumps are benign, but the herpes one is usually what the more people are concerned about. And I would say when you do have the symptoms that looks like herpes outbreak, I think it's within like the first 3 days is really important for you to get that swabbed so that way you can test for a herpes virus itself from that outbreak. And that's how you can really formally diagnose it. Yeah.
I have a quick question. How do both of you feel about shaving, waxing, laser hair removal?
I favor laser hair removal because I think that if you don't want hair in certain places, just kill the hair follicles, right? Shaving, I don't have a problem with it. I have more of a problem because people do not have really good shaving hygiene. They use the same razor for like a month, or they use a razor they use on the armpit down there. You just can't really cross that. You should really switch your razor like once a week and really make sure it's dry. And so it can create a situation where you're more likely to have ingrown hair. Waxing, I feel like if you have to pick between shaving and waxing, I think I will pick waxing better because it at least gets from the source. I don't know what Elizabeth thinks, but yeah, I would favor more hair laser removal. Not everyone can afford it, but if you have to do one or the other, I would recommend more waxing than shaving.
I agree on the laser hair removal for sure if you can afford it. It's just, some women, if you have really light colored hair, you actually can't get laser hair removal, which kind of stinks. But I honestly think it's really interesting, especially like a lot of my patients who have vulvar dermatological conditions. It's different for everybody, honestly. Like sometimes, growing your hair out actually feels better. For other women, shaving feels best. For other women, waxing feels best. So it also kind of depends on like, what feels best to you, frankly. Yeah. I think if you're going to shave, just same thing. Make sure you're changing your razor frequently, but also not using like, raspberry lemonade shaving cream or something like that. Like an ultra sensitive shaving cream that's free of perfumes and dyes. So I usually recommend that with like a man's razor because I think typically those are better quality, especially the ones that aren't like, you don't throw the whole thing away every time.
Yep.
But I think it honestly it's like dependent on each woman. Sometimes.
I also add, like, I think a lot of women shave right when they get in the shower. I think it's absolutely the worst thing you can do. You have to take a shower, let the soapy water kind of moisturize your skin and dampen your skin first, and then you shave at the end of your shower, and also shave with the grain of the hair and not against it because you're more likely to have some cuts and abrasions. I think that just having, and then also use an aftershave. Men use aftershave. I think you should definitely use aftershave, and you can use some what do you call it? Ingrown hair prevention solutions that you can apply on your skin to try to decrease inflammation as well.
So before we get to everybody's questions, the last talking point is not women not feeling interested in sex anymore? And can a woman's body be revived? Can you get it back, you know? Like, and I think it's such an important question and such an important topic. I think, especially because I see a lot of questions coming in about menopause.
Yep.
And, you know, and I also think it's like the desire, but then also like knowing that like you still want to feel good, but then also like maybe you're just like, my man's annoying and I just like don't feel you know what I mean? Like you can still pleasure yourself. And I think that
Yep.
that's important to talk about.
Yeah.
Because I could see people being like, I don't really want to do it with him anymore. But it's like, well, let's do it to yourself then, you know? Like Mary Ann, like don't, you know what I mean?
Amen.
Right.
I 100% support that. Yes.
Yeah.
So I mean,
So that's something that I think women are afraid to talk about, just like the lack of desire and kind of how to get that back.
yeah, for sure. And I mean, the thing is, decreased sexual desire, it's so common among women. And the thing is, it's not just menopausal women. It's
Right.
women, I see women in their 20s, 30s, 40s, like all ages who have decreased sexual desire. And the thing is, it's not as simplistic. The woman's sexual response is so much more complex than a man's.
Yes.
So, I mean, there was, I'm not going to get into this whole like sex researcher, female sexual response models, et cetera, but basically there was somebody who came out in 2010 and she basically said the female sexual response, it's not just like simplistic. It's not just like, you know, you have this innate desire and then you get arousal, you have an orgasm, then you go back down to resolution. She said that it basically was more cyclical and a lot of women don't necessarily have spontaneous sexual desire, especially if they're in long-term monogamous relationships. It's more of like a receptive desire. And it's almost like, I think of it as like going to the gym. I don't necessarily always want to go to the gym, but I know I'm gonna feel good afterwards. So I go, I'm open to it. I get going, I'm aroused, and then I want to carry on. So sometimes the arousal actually comes before the actual desire.
Yes.
But regardless, you know, it's not just, you know, like there's a pill that you have to pop that you have to add more testosterone or estrogen. I mean, first and foremost, it's, you know, life stressors cause decreased desire. And women kind of, you know, they'll come in and they want just like a pill to fix it or like something simple. And it's typically not simple, you know, it's, you know, stressors about like, you know, young children, you know, you have like family stressors, financial, you're overworked, you're tired, you're exhausted, you're fatigued, you know, you maybe have chronic medical conditions where your body hurts and you just don't feel like sex, you know, relationship issues. If you're always arguing with your husband or you just really don't like your husband or your partner, sorry, I'm being so like, I don't know.
No, I think that's important. It's like, I read enough stuff and listen to podcasts where it's like, I went to therapy to fix my marriage. And then I realized I actually didn't like my husband.
Exactly.
And it's like,
I had a patient years ago and it was, I mean, I was treating her for sexual desire and we had tried all these things. And finally she said, Elizabeth, I realized I actually have normal sexual desire. I just don't want to have sex with my husband.
Yeah.
He's right. Weight. He's fat right now. I was at the gym the other day and I saw this really hot guy walking past me and I was like, wait a second, I want to have sex with him. Just yeah. But the thing is, I mean, it's attraction. Are you so attracted to your partner? Is the quality of sex play good? I mean, do you actually have an orgasm? Do you feel pleasure? Is it lasting like an hour and a half and you're like, okay, come on already, let's go. Yeah. You know, I mean, there's so many factors. And then menopausal, because your hormones tank with menopause. So your estrogen and testosterone decrease and that affects your whole systemic well-being, but it also affects your vulva and vagina. So it's dry and it's frictiony and it's uncomfortable and you feel like burning or discomfort after sex because you've decreased hormones to your vulva and vagina as well. And then honestly, if you have a history of trauma, I mean, it's really common for women to have decreased sexual desire with any kind of sexual trauma. And sometimes it can be lifelong, frankly. So I think it's really imperative to actually kind of like isolate why your sexual desire is decreased. And, you know, lastly, your own body image. It doesn't matter what you look like, what your weight is, but if you have poor body image and every time you look in the mirror, you have negative self-talk, it's literally impossible to desire another person. There's this, you know, sex
or feel like you're desired by someone else, right?
Exactly. If you don't have that. Exactly. You have to feel desirable to desire somebody else. So
everything you said, I concur with everything you said. What I normally tell patients is, you know, if you're coming to me and saying I don't have, you know, desire to have sex, I'm like, number one, is it really a problem for you or your partner? You know, some people are asexual. Some people are okay with having sex once a month. Some people are just like, I'm not really interested and I'm okay with it. The problem comes in when your partner wants a certain, frequency of intercourse and you don't want a frequency of intercourse, then yes, that's a problem. But if both parties are like, we're good, once a month is fine with us, it's not a problem. Now, everything you said in terms of, the desire and just not really being mentally there to have intercourse, absolutely. But some of the things that we can manage is, when you start having pain with sex and it feels like a knife stabbing you, like stabbing you in the vagina, you definitely don't want to have sex, right? And so that we can fix. That I can fix for you. There's different things you can do. We talked about coconut oil or Uber Lube. Honestly, a lot of women shy away from, vaginal estrogen. But for the postmenopausal woman who's tried, the Astroglide doesn't really work, vaginal estrogen can actually really help plump up the vaginal lining so you can have less painful sex. And then once you start getting more, sexual activity, again, use it or lose it. So if you're not having sexual activity because it's always painful, and you're able to lubricate your vagina and have more frequent sex, you have more blood flow to the area, and you have more pleasurable sex. So you have to decide, is it normal for me? Am I okay not having sex and I'm okay with it? It's not a problem. It's not a problem if you don't want to have sex, but it is a problem if you do want to have sex organically. History of trauma would definitely, you need to get to the bottom of that. So there's not a one quick fix. You just have to figure out why are you not having interest in intercourse.
Exactly. And honestly, women who are in their 20s and 30s, a really common cause is women who are on combined oral contraceptive pills. So the estrogen in that pill gives you this like smidge of estrogen every single day. When it does is it decreases your free testosterone, the testosterone that actually causes, the desire and the libido, et cetera, to increase. So, I mean, it can be as simple, honestly, as we're talking about like simple fixes, like that's a simple fix often, honestly, it's just getting off like a combined birth control pill.
Yeah. All right, let's move to some of the Q&As. I have found that my clitoris has sunken. Would that affect my sexual desire?
Yes. From dermatological conditions or from menopause, it does shrink.
Yeah, so it does.
I actually prescribe an estrogen and testosterone cream topically always to women who are menopausal, because if you just treat the vagina, it's not actually treating the source of pain.
Right.
Vaginal dryness, it's not painful, it's just dry. The pain exists around the opening of the vagina. So I have women apply a cream that contains estrogen and testosterone to the opening of the vagina, as well as above the clitoris as well.
Yep.
Are fibroids more prevalent in Black women, and can fibroids cause pain during sex?
Yes, fibroids are more prevalent in Black women. Yes, it can cause pain with sex, particularly if you have what we call bulky fibroid. And, when you have maybe a small 2 centimeter, 3 centimeter fibroid that's isolated, that's not the reason for your pain. When you have more of a, what we call golf ball size or grapefruit fruit size, and you have multiple fibroids that's essentially taking up the space in your pelvis, it becomes pressure, it becomes bulky. And so sex will be painful in certain positions because you're essentially pushing, your partner's essentially pushing against the fibroid. And yes, it does get painful, especially if you have large fibroids. A lot of women think they have small fibroids, that's the cause of my pain. No, it's not. It usually has to be a big enough fibroid to cause your uterus to be enlarged and take up more space in your pelvis.
And does it happen more with Black women?
Yes, it does.
It does.
Yeah.
Okay.
Mm-hmm.
And that's genetics, I'm assuming, right?
It's genetics, it's predisposition to it. But I think for some reason, Black women just have, it's prevalent in a lot of different things. It's prevalent in Black women, but definitely fibroids is one of the bigger issue in management in Black women. I think part of that is how we manage women. Black women, when they come in for the complaints of heavy bleeding, they're misdiagnosed or diagnosed later. And so by the time we figure out you have fibroids, they're now enlarged, and now they're having more symptoms, not just pain with sex, but more like urinary symptoms. They feel like they can't really void, or they feel like they have to shift when they void, or there's problems of having bowel movement. So I would say delay in diagnosis with Black women, but also because genetic predisposition definitely can increase more likely your risk of having fibroids. Yes.
Adriana, hi. She said that she didn't realize I was on the radio. So sigh. Somebody said this early. Oh, vaginitis. Am I saying that right?
Vaginismus.
It's actually an antiquated term. So sexual medicine experts don't actually use it anymore. It typically was a term that was coined in the late 18th century off of one patient who had a history of sexual trauma. and wasn't able to achieve penetration because she was having spasming of her pelvic floor muscles. So they coined the term. A lot of, just OB-GYNs use it, a lot of like sex therapists use it. It's not a term
It's not a thing.
ever used. It's high tone pelvic floor dysfunction. It's your muscles that are tight and spasming around the opening of the vagina.
Right. Good to know. Somebody said, should you squat when using a public restroom? Does that matter with anything?
I do, not because of anything else.
Totally bad for your pelvic floor. Terrible for your pelvic floor. And often you don't empty. So, I mean, I'll be honest with you. I think I spent like 5 minutes coating the toilet with toilet paper. Yeah. Just because you often don't empty, and when you're squatting, your pelvic floor is in a state of contraction.
Yeah.
So
you're not really emptying it. Yeah. But I have to. I cannot. I'm just not doing that.
Is there a certain age when women, we kind of talked about this a little bit, one of our other ones, where a woman said she's over 70, should she stop having tests? But I'm assuming like you should still be taking care of yourself and having the tests.
What STD testing? Is that what you're talking about?
Yeah.
Oh, absolutely. If you're sexually active, you should absolutely get STD testing. I think there's a misconception that, older women are not having sex. And I encourage it. Like when I have a patient who's 70 and she's saying I'm having sex, I'm like, yes, girl, get it. Yeah. Like, this is great.
Did you see
if you're having intercourse and you're not being protected, absolutely you need to have STD testing. There should definitely not be an ageism related to this.
The new really, really, really fast and kind of off topic, but not really, but the new trailer for the 80 for Brady movie came out. It's with Jane Fonda and Lily Tomlin, and they all go to the Super Bowl together. But it's very much about like, it's kind of like Stella got her groove back, but they're in their 80s. And I was like,
yes.
I love that.
I love that.
Like, yes. It's the new 60, you know what I mean? Like 40 is the new 27. So like,
yes,
it's so important. Somebody asked dark spots on the labia. Is that anything that obviously people just kind of go to your go to your doctor, ask, get tested, all the things?
I mean, dark spots on your labia is completely normal unless it's changing over time. As I liken dark spots as like age spots, right? Your labia is like regular skin. The same way you have dark spots on your skin, aging spots on your extremities is the same thing down there. But it's not normal if the dark spots become like clusters and they start to change color. They look like the fall colors, like brown, yellow, dark red. That can suggest something else. But yeah, it's completely normal when you have it. What do you think, Elizabeth?
Yeah, exactly. Just like if they're raised or if they start to become like, like itchy or something like that, definitely get that checked out for sure.
Correct.
Yeah. Last question. Is there a way you can properly show how to do a Kegel, or is it that goes back to like, please go to see a pelvic
floor physical therapist? I feel like you can describe it until you're blue in the face, but most women, frankly, are not connected to their pelvic floor.
Right.
You explain it, and they're squeezing their butt, and they're doing like
they go in. I'm like, they'll put down. I'm like, no.
Yeah. So I would just say the only way to for sure not do it is some people explain women, to stop the flow of urine. That is absolutely not how you want to do a Kegel, because it's actually isolating, really superficial muscles that can actually cause more spasming and urethral pain. So see a pelvic floor physical therapist in all honesty. But what you can do is you can actually insert your finger into your vagina. And if you can feel a contraction, a squeeze around your finger, frankly, you're doing it correctly.
That's good to know. Okay.
I would liken that to when you're with your partner, the same thing. Like if you try it while you're having intercourse and you try it, and then if they can feel some level of like circumferential like tone, that's usually tells you.
Can we go back really quick? A couple people asked if you could list the clean lube. So we said the coconut oil, we said the coconut oil pack from Trader Joe's, and then you said a specific one called like the clean love.
Good clean love.
Good clean love. I wrote it down.
Good clean love and slippery stuff.
And
those
slippery stuff. So good
really
clean love, slippery stuff. And you said Dove sensitive unscented soap, right?
Bar. Yes.
Bar.
The bar. Listen, wait till I call my
Uber
mom.
Lube. Don't forget Uber Lube.
Yeah. Uber Lube. Yeah. When I tell my mom, I'm like, well, you were right again when you didn't let me use the bubble bath.
Yes, she is right. Mom is right.
Right again. Thank you so very much. Amazing questions. thank you everybody for taking the time, and, you know, kudos obviously to our amazing professionals, but then you who took the time to care about your body, to want to know more, because it's your body. So if it's not functioning the way that you want it, there is absolutely nothing wrong, and it's encouraged to please go to a professional. Virtua also has an amazing pelvic floor team. So
Yes.
start right here, you know, which is amazing. And as you can see on the screen, so you can call 833-VH-WOMEN or visit virtua.org/women. And I can't thank you guys enough. Obviously, Elizabeth and Dr. Adeliyi. Did I say that right? I'm so practicing.
You had it first, Adeliyi, the Y.
Adeliyi, there we
Yes.
go. You guys are so amazing, and women are in the Delaware Valley are so lucky that they have you to help them, because it's a lot of women don't know who to turn to, and the fact that Virtua has this amazing team is incredible. So there will be a transcript, and then they're going to email to everybody. And thank you all for the really sweet comments. We really appreciate that. So everybody have a wonderful rest of your night. Again, virtua.org/women. Have a very happy Thanksgiving and a good holiday season.
Bye, everybody.
Bye.
Yeah, thank you.
Bye.